Mohebi from Parsa Mohebi Hair Restoration. We have another mega FUE session, 2 days case of 4,000 grafts. Class 3 vertex, and he's moving toward class 6. And we're going to cover the front and crown and top area. Restore the front area. We're going to keep the crown for the back, and we're going to use the robot and manual technique together. The tension is on. The robot is going to approach. We're going to do some of the case with robot.
Refire or restore.
It's working while they are extracting the grafts that we have removed from previous attempt. As you can see, it's going from this side to the other. Karen, my assistant, is removing the grafts that has been harvested before. So we keep going from side to side, and we can harvest and extract at the same time. The robot, the microscope of the system recognizes the grafts. Those green dots are the grafts. It's rather than grafts. So the robot recognizes what's the next attempt, and you see it as green, and the purple that you see here is the next one after that. The system has that circle around it, so when one attempt is done, the robot knows that it shouldn't go around it for that distance, which is 1.7 in this case. The overlapping of the grafts and going and harvesting on the areas that has been harvested before. So here. We set it up at the beginning of the day, shows the depth of the sharp punch and then blunt punch, and this is the angle of approach. There's full control on the depth and sharp and blunt and the angle of approach, and we can change those parameters as we go. Extraction of the grafts, and we are extracting this manually now, which is going pretty well. A manual punch, motorized, and also blunt punch, which is working pretty well for this type of hair. To have a good hand-eye coordination and also be able to visualize the inner direction of hair. We're done with about 2,000 FUE grafts on this mega or giga session FUE transplant. It's going to be for 2 days. We're going to follow tomorrow. Another close to 2,000 grafts that covers the front that we did today, and we're going to leave. We left the crown for tomorrow, and we will see it. This is how it looked when he left today. Front, corners, the other side, and the view from the top. The whole front is with a very reasonable density, and tomorrow we're going to take care of the rest of the scalp. All right, we're doing the second day of 2-day FUE procedure, and we're going to cover the crown. Front yesterday, the hairline was almost done. We still have to go back and add a little bit more in the back of it. This is how we did it in front. A little bit on this side, we're a little bit short here, and then the whole crown should be redesigned. And we have to redesign the roll area, which is very important. And I'm going to show you. I'm going to add a good density to the crown and some around it. Let's look and see how we design this. The design of the roll area, we have to go with the direction of hair. As you can see, the hair parts at the middle, so we just follow that, and the density should be pretty high in that. To the periphery of the area, the density goes a little bit less, and the other side, so the whole crown is going to be covered.
Joke of the day.
All right. Well, we start extracting first of all, and I have a joke. I do have a joke of the day. You don't believe that I can deliver a good joke? I prove you wrong. She's here angry because she was teasing you. Extraction, second day of 2-day procedure, FUE. We were shooting for 4,000. We might be a little bit short of 4,000, but we're almost there, which is enough to cover the front and crown. Procedures, we want to make sure that we don't go out of the safe zone. Hair is supposed to be permanent. So in the future, if patient needs more hair transplant, we can go back to the same zone or use the beard hair. Our 2-day FUE procedure, mega session, some people call it giga session, is over. We gave the patient about 4,000 grafts. Large for FUE, and patient's going to be coming back for hair wash tomorrow, and after that, after the first few days that him washing at home, is going to be back to normal. These are the pictures. This is how he looked when he left today, and let's look at a few different pictures from different angles. This is how it was. Opposite side, this was done yesterday, but we went behind it and filled those areas that needed to be filled a little bit more, and then we did the whole top and crown, I mean not the top but the crown and the crown area, and that's how it looked from the back. So that area is good, reasonable density was filled. The important thing about the crown area is that you have to put more weight, more density on the roll area, which is that on that side for him, and hair goes out. It's considered another hair. The part that people come to see a scalp again, and because hair direction goes to a different direction, and that center becomes not much layering cover. So finally, when everything grows, hair grows more here, and the layering helps the hair from this area with more density to cover the other area and give a good balance.